Well, don't ask what's wrong with you, ask rather what happened to you. That's a phrase at the heart of a new way to treat children who have experienced violence or other trauma in their lives. And Wisconsin is emerging as a state leading the way in something they call trauma-informed care. I'm honored to be joined this morning by First Lady Tonette Walker, who's championing that cause on behalf of Wisconsin. Great to see you, Tonette.
Yeah, good morning.
Well, tell us a little bit, give us the layman's version here of what we're talking about when we say trauma-informed care.
So trauma-informed care is a philosophy, and it really came about because of the Adverse Childhood Experience Study, ACEs. And really when we know that children live in toxic stress each and every day, that their brains don't develop the same way, so they actually don't learn the same way, they might not have the same outcomes. And trauma-informed care is a way of really a philosophy about how we can treat children and families in a different way to have better outcomes.
I think that's an important point you raise about the brain actually going through changes, because it means that we have to consider children who've been through some sort of trauma, that when we tell them just behave or just stop this whatever it is you're doing, it might not be that simple because they might not have that same capacity.
Exactly. And so we want to have a way of bringing success to families and children who every day live in this toxic stress. And so Wisconsin, we are leading the country in promoting trauma-informed care.
I know you brought some other first spouses in to try and join your effort as well from other states. Boy, it's more than 10 states, I think, who joined you the last time around. And then you continue to try to lead this effort not only in America but across the world.
We had spouses, first spouses from both sides, Democrats and Republicans, came together to work on this because we know how important it is. And now this weekend, or these last few days, I should say, we have a Norwegian delegation that heard about the work that we're doing here in Wisconsin, and they're here.
So on the person level, are we talking about doctors? Are we talking about educators? Are we talking about social services people? Who is receiving this new training and this new way of thinking?
So we're talking about everyone. So when I talk about it, I talk about the bus driver and the superintendent of schools. I talk about employers. I talk to county agencies. We are training the public defender's office and the district attorneys on trauma-informed care at this point. We have county agencies, government agencies, which has really been great that we've been able to pull government into this. It's one of the things that we in Wisconsin have been able to do here because of my influence. And so I think we're different. Wisconsin is different because we have that opportunity.
All right, First Lady Tonette Walker, great to see you. Thanks so much for sharing it with us. And I'm sure we'll talk about a lot next month as the Awareness Month comes around.
Yeah.
All right.